All right, welcome everyone to the first episode of FRN News. We have a special report tonight that we're going to have, and we have Dr. Anna Jackson with us tonight to talk about a few different topics and just talk about the pandemic in general and what's been going on for people in the medical world, how this has kind of shifted medicine into a different avenue, and what we all can do to keep our families healthy and safe during this time. So welcome. Thank you, Dr. Jackson, for being with us today.
Yeah, thank you so much, Scarlett, for having me.
Well, we're glad to have you here. So, it's been an interesting time for medicine, right? I mean, the last, let's say, 5 months from, let's say, the end of January until now has been a whole new paradigm of things that most people in society have never thought that we would have to deal with, right?
Yeah, completely. Yeah, and it's going to be interesting to see how this shapes our world,
It is. But I think that I've been really preaching here that as things are changing, instead of necessarily gripping to the fear that could occur with that, to start thinking about ways that we can shift to things that we want to see out of this, right? If the world is changing, if we're in this new world, we don't have to accept it for what it is, but we also could try to shape the world ourselves.
Yeah, completely. And we can jump into it, but I think being active and having a voice, talking to legislators, also just keeping yourself personally healthy during this whole epidemic or pandemic.
Yeah. Well, and I think that that's something that, people have been thinking about in the past or maybe touching on or dabbling in, but now health has become paramount at this point. But for most people, especially when it comes to COVID-19 or coronavirus, we always have to remember that it's such a very small percentage that have extremely severe symptoms. It is not a large group of people that are really struggling and having a hard time. Yes, the numbers seem sensational. They do seem like large amounts of people, but in the grand scope of medicine and people and just statistics, it is quite a minute number, right?
Yeah, when this first happened back in March, I was nervous for my patients, especially in the 60 plus group. I was nervous for my parents and my family and my grandparents. And I didn't have the statistics or the facts to know what to do. And so at that time, I really cautioned all of the families that I work with to quarantine, to limit exposure until we have more data. And I think that was a really good thing to do, and I don't regret that. But as time has gone on and we are seeing, rates in states and around the world not being 6% death or 4% death that we had originally thought, and seeing the financial hardship of so many people and the anxiety. Right now, that's all I'm treating. I'm treating so much anxiety right now. A lot of my patients are drinking. They're going back to old habits to cope with all of the anxiety and fear that they're having. And that to me is far, far worse than what COVID has created. And it's so sad that people have died from this. I wish nobody would die from any virus or bacteria, but the financial hardship and the mental illness that I'm now seeing is far outweighing what's happening with COVID.
Absolutely. And I think that was one of the things that we had brought up too, was the mental health aspect that I think people are ignoring. Mental health is such an important part of our lives that when you shift people from their everyday structures and shift people from their everyday lives, right? And, just change everything about what we knew, like how we interact at stores, how we go shopping, how we just conduct business in general. There needed to be a safety net for people to understand. I mean, they didn't even teach people how to put on masks for, infectious disease control's sake. That was a big issue for us because here on the Freedom Revolution Network, we started talking about this January 25th when there was just a few cases in Wuhan, China. And we started telling people to get ready because we didn't know what to do otherwise. And we're seeing people in full infectious disease control, suits and things. So we told people, at that time to get masks while they were still on the market, to prepare and just think about staying inside for a while until we can find information otherwise. And we told people to not be afraid, but also to be prepared and think about what they need to do. Maybe you want to get a few weeks of food. Maybe you want to just stay in and limit your contact with other people who are in your household. And we just kind of picked up on that from the beginning, just because from an infectious disease control standpoint, that's what you do. But to even see someone like the United States government just kind of leave everybody on their own was shocking. And to not hear them telling us, explaining, other countries give, pandemic kits and other things to their citizens, where we got no explanation, no training, nothing, just told at first, don't wear masks, it's fine. Now wear masks. And there's really no guidance behind it. They claim that there's, studies and proof, but they don't back that up with information either. It's just kind of, you take it as I say it and leave it, or that's how you need to go about it. And I find that to be a shocking way to interact with the public. Just for a bedside manner from a public health perspective, I just think it's poor.
Yeah, completely, Scarlett. And likewise, I feel very frustrated at the health agencies and the Department of Health that oversees my own license as a naturopathic physician, because you would think that I would get updates as a physician as to what the rates are, what the numbers are, where to send people to get testing, what that testing is, what kind of test it is, what's the false positive and the false negative rate of
even
COVID
the
tests.
They don't even explain. They're just like, oh, reagent test. And I don't think that they're really explaining the mechanism of what they're using.
No, and I have felt very frustrated at my own health agencies that regulate my license, because as a physician, you would think that I would have that information, but I'm not even getting it. So yeah, I hear you. I'm frustrated with, and I think this really sheds light on the fact that all of our governmental agencies and health agencies, when it comes to a real epidemic, they're really, really disorganized.
Yeah.
And we're seeing that play out.
And they had time to prepare, because let's just think about even Ebola, right? Or MERS. There've been times before in the past where they've known that infectious disease control and coming up with a plan, if there was a serious level pandemic or endemic disease, they preached a lot about vaccinations and their possible potential rates of infection and outbreaks and this and that. And it just shows, even if there was an outbreak, they were more afraid that they probably couldn't control it rather than the outbreak itself. Because it shows now they had no game plan. They had no real plan for large-scale mitigation of anything, any disease, in my opinion, at this point. I wouldn't feel safe to put my trust in the hands of the CDC or any other organization, because at this point they've shown tests are faulty. They can't explain their tests. They can't explain their methodology. They can't explain where all the tests are coming from, what companies, how they develop the tests. But yet other countries have been using other sets of tests. So how can, in a clinical format, let's say even just to analyze data, how can you make good decisions for public health policy when you have sets of data with tests that you don't understand all the mechanisms behind, and you really can't use as different control? They're all separate tests with separate, some are using the IgG, IgM sets, some are using, just reagents, of which they don't say what the reagent is, they just say they need it. Like in my state, they'll say, oh, well, we just need more reagent, that's why we weren't able to do tests, but they don't say what the reagent is.
Yeah, and really, I mean, as a licensed physician, I do not know those answers.
Yeah. And that's scary. And none of them do. I don't think there is a doctor who feels comfortable or knows that answer at this point. And that should really concern people, that what do we pay dollars for if they are, and these are supposed to be the professionals in infectious disease control.
Yeah, completely. And Another part is I was so frustrated at this. I actually got an email from my Department State of Health in Washington
Okay, yeah.
urging us to continue to vaccinate the elderly population when it comes to flu, the influenza vaccine. And if anybody at that health agency has read any research, they would know that there was a great study that came out last year that actually showed that if you get an influenza vaccine, you are much higher at risk of any COVID infection, coronavirus infections. And so, why is the health agency that's so obsessed with protecting people and locking people in their homes during this outbreak? Why are they telling doctors to vaccinate? And by doing so, they're going to increase the risk of those people getting coronavirus infection. So I was very upset to see that.
Well, and we know that right before the lockdowns occurred in most long-term care facilities, their patients were vaccinated for coronavirus or for
influenza.
For influenza, and they had a mass push in all of these places to get their residents protected. And I think that is probably why, like in states like mine in Minnesota, why the numbers are the highest. I believe it's like 87% of cases come out of long-term care facilities with COVID-19 infections. And so the highest population were the ones that they claimed, this is why we kept all visitors out. This is why you can't be around your grandparents or your loved ones. Even one of our hosts had their grandfather die during this time. And the grandmother was staying with the grandfather in memory care just to be there for his own protection and safety. And now they're saying that the grandmother can't leave and she has to take all these coronavirus tests. And if she doesn't, and she came back positive now. And so now they're holding her for even longer and won't let her leave, won't let any of her family members or even have power of attorney. She can't even go to her husband's funeral. And they had been together 68 years. They're not thinking about the human effect of their policies on individuals and groups and the mass mental health as a whole. And as things keep happening, the public populace is surprisingly turning against their narrative. I had heard that in Australia, they've had an overwhelming amount of mail to their health ministers saying, we're not going to get vaccinated.
That's so great.
People are turning the tide and thinking about, well, what can we do to protect our health if no one else will? And I think that that's an attitude that especially you've had probably your whole, life and career as you decided to take this path, that you were going to take control of your health and help others find control of their health, because that is what's truly important. There's a lot, you may not know this, but I have Ehlers-Danlos syndrome, and I have a lot of chronic illnesses that I believe were brought on by vaccination and brought on by other things that, have happened in my life with treatments. I've had rhabdomyolysis. I've had a mosquito-borne virus. I've had a lot of weird, strange medical anomalies. So with that being said, I've had to go through this journey of allopathic medicine where, for many, many years in my youth and in my childhood, I was very sick, had asthma from a very young age, was on lots of different medications that are now found to cause all different sorts of problems. To then finding in my early 20s that I could find different and natural ways of health that actually worked, that actually, fit my needs. And that started me on a learning curve and a journey of looking into other modalities, other alternative medicine, alternative health, and what could I do for myself? Because I had been to doctors for so many years where I was just tired. I was tired of the runaround. I was tired of either inappropriate bedside manner or just flat out refusal. I was tired of the specialist game where you go to a specialist and then they're like, oh, well, we don't know really anything. Go back to your primary care physician. Primary care physician's like, oh, well, now you can go to the endocrinologist. Now you can go here. Now you can go there. And then you just keep going to specialists forever. And then,
I know. And then every different specialist gives you a different drug. And so by the time you know it, you're on so many different medications because none of them talk to each other.
No. And they don't know how they work pharmacologically. That's a true statement. In fact, by the age of 18, I was on 21 different prescription medications. And, you know, I just straight up asked one of my doctors, I was like, what's the pharmacology on this? Like, has anybody ever, like, and they're like, well, we can't really do anything because nobody's ever been on those exact mixtures of medications to say one way or the other about any side effect that you get. Is it medication related? Is it, you know, disease function related? They have no clue. So they're just shooting in the dark and adding more medications as they are just trying to basically keep you in some form of stability, which is, in my opinion, instability. You know, they're literally just trying to throw everything they can at it to just try to contain or mitigate rather than trying to find out root causes or problems or potential disease function.
Yeah, and really, Scarlett, the problem is that medicine, Western medicine, which I call allopathic medicine,
Yep, I do.
Yeah, is so compartmentalized to where there's specialists for everything. And in medicine, they do not look at the whole person. They do not see a relationship between the mind and the body and how emotions affect the mind and how my heart affects my brain and how my brain affects my gut. Because they have specialists for everything. They have gastroenterologists, they have neurologists, they have cardiologists, you know, all of the ologists, urologists, nephrologists,
Yes.
and they don't talk to each other. And there's no person, well, it honestly should be the primary care physician that oversees it, but the primary care physician is so limited in what they can do that all they do is refer to the ologist and
Yep.
specialists, and nobody ever looks at the overall person. And what ends up happening is depression, because when you take a medication, and I understand that some people do need medication, and I'm not against medication, but when you're treating chronic illness and chronic disease, a medication will never ever heal the problem. All it does is suppress the symptoms so that the symptoms go away. But the problem, the underlying issue, is never solved through using medications. And so you have doctors who are not taught to look at the whole person. They don't even have the time because they're seeing you for 5 to 10 minutes per visit, because they have to see 20 patients a day to meet their quota. And so you just do not have medical professionals in allopathic medicine that are ever going to get to the root cause of the problem.
It's set up. It's just by design, and it's the way that Red and I, my co-host on another show that we do here on the network, we talked about the history and roots of medicine and where we lost natural medicine, because we wanted to figure out where along the course of history did we kind of shift away from folk medicine and the ways of, you know, tribal medicine and those types of small forms that were in everyone's communities to the big industrialization. And it's an interesting history that we have presented in the past in previous shows about how these certain figures in history have decided that using chemicals ended up trumping out natural plant medicine because they were industrialized easy, they could make them in quantity, and they could distribute them widely.
Yeah. It was Rockefeller and Carnegie who created what we now know as allopathic medicine. And it was recent, you guys, everybody who's listening, about 100 years ago is when everything changed. Prior to that, every single person, and I'll just show you guys, because I have all of my kids with me in my office. You know, I practice homeopathic medicine and herbal medicine and nutrition, but literally 95% of what I do is homeopathy. And every single family had a kit like this in their home in the late 1800s, early 1900s. And what happened is Rockefeller, who actually had a personal homeopath follow him as his doctor, he saw the potential in allopathic medicine and pharmaceutical medicine to make millions upon billions of dollars. And so he employed he wasn't a doctor, but a man named Flexner to go around and put a gold star next to all of the medical schools that were practicing allopathic medicine. And so overnight, all of these homeopathic medical schools, which we had so many homeopathic medical schools, we had 22 in America by 1900. All of the naturopathic schools, the chiropractic schools, the herbal schools all shut down. And then we started to see a rise in allopathic education in the 1920s. And it was not that long ago that everything changed. And I think a lot of people are so unaware that just a little over 100 years ago is when everything changed. But prior to that, everybody had a homeopathic kit. Everybody grew herbs in their garden, and they knew what to do with those herbs. They knew how to make them into tinctures. They knew what good nutrition was.
They grew other plants like creeping Charlie or dandelion or wild lettuce in the front yard as ground cover instead of what we know as a traditional like grass lawn. That wouldn't have even been known in the late 1800s because plant medicine was life, right?
Yeah, completely. And this knowledge of taking care of ourselves and really empowering ourselves has been purposely stripped from us by those in power. And it continues to this day because they don't want you to know that literally this kit, a $5 homeopathic remedy, can cure chronic disease. They don't want you to know that. They don't want you to know that an herb outside in your garden can cure an infection. And they don't want you to be aware of these simple, easy, amazing medicines that the earth has always given to us. The earth has given us everything we could ever need.
Well, and that's the truth. And I think people forgot that because it was by design. It was easier to take away medicinal medicine. We know why even things like cannabis were taken away was because of industrialists like it. I can't even think. They're the ones who make like Teflon and that group. I can't even think of why did it leave my mind?
I don't know what you're trying to think of.
The Teflon people were the ones who made industrialized materials or were the reason why they went to the American Medical Association and decided to go petition against cannabis because they were making DuPont. It was
DuPont.
DuPont was the one who was making all these industrial materials that he believed could replace hemp. And so he decided to go to the American Medical Association and try to go above them and go to Congress to get laws passed because he was friends with the vice president at the time and decided to personally counsel him and tell him about this great business decision that they had and do all these things. So it was a very interesting thing that they've done. And I had shown people because I had at the beginning of this also purchased a basic homeopathy kit, and it's something simple, right? And it has it has 36 remedies in it. So and it really was decently priced. It was around $50, and I felt like for 36 remedies that was a good price per remedy. And then I also got one that's considered first aid that has everything in 200C. And it has a few other remedies that aren't in this basic kit. But I mean, this pretty much, covers a good range of what you would want to deal with at home. That I have actually been finding myself using more often than not because I've gotten a few books to try to help my understanding. I got the complete book of homeopathy. Oh, it's a purple book. I can't think of what her name
Miranda
is.
Castro.
Yes, that book. I got that book, and then I also got this one because I have littles. So Homeopathic Medicine for Children and Infants by Dana Ullman. And so it's a good one that breaks it down just for kids, and it kind of gets you to start thinking about it and framing it to have health conversations with your children, and try to get them to describe symptoms to you and try to get them to be more interactive in their health. And then by that, choosing a remedy that will fit the situation as well as the symptoms, and then going through teaching you how to do a whole protocol, but within the realm of small children and infants. And I thought that that was something that, we don't always think about, but everybody in our home is going to have a little bit different individualized care when it comes to that. And the further you get into homeopathy, the more you can understand when you can use, all the remedies for things. But I think just basic understanding that everybody's going to be an individualized patient is like the first step in keeping.
Yeah, completely. And I'm so happy that you had a kit.
Yes, I told everybody else to get one too, and we were, because when we first started hearing about things to use, right, like alternative remedies, because we're big about alternative remedies here. One of the things we were hearing about was with the Indian college and arsenicum album being used as a potential preventative. And that sparked my knowledge because I also work on an organic valley dairy farm, and there they use homeopathy. So no other, things are used, definitely no vaccines or anything like that at all, but homeopathy is used there, and essential oils. So those are used in synergy with the animals. And so, it's been helping me learn about this whole new world that we can use for animals, for ourselves, and just about what is taking control of healing. Because at this point, they've shut us regular individuals out of medicine, out of society. They closed us out of the hospitals. They've closed us out of clinics. They've closed us out of really getting care unless you have these symptoms. So what does that mean to the average individual if something happens? That became the dilemma for me. That became the considerations that I had to make. Like, well, what is my family going to do if we even choose to bug out and go to a safe location? What are we going to do if someone becomes ill or just has a common complaint? Or, how do we control that? How do we take hold of that? And so that's what brought me to homeopathy and just natural herbal medicine and teas and tinctures. And it's been a very, many year process, but now culminating into something that I can use in action and practice. I don't think it's something that you should necessarily rush into, but there are ways of learning from, the beginner level all the way up to expert. And then even beyond, there are things to always learn, because as the technology gets better to analyze these things, we get to learn more information about what's actually happening.
Yeah, completely. And I fell in love with homeopathy personally because I used to have really, really bad periods. And they would just, put me on the ground. I'd be in so much pain, 10 out of 10 pain every month. And I tried so much and nothing helped me until I went to a homeopath, and he gave me this remedy. Literally, I took one dose of a remedy and I've never had that ever since. It just completely healed my body. And that's what these medicines do. Herbal medicine, homeopathy, although I love homeopathy.
Yeah,
but
there is a specialty that's very different about it compared to herbal remedies in their own right. It's a whole different feel and energy. How it was explained to me is that homeopathy also, besides just its properties, also has an energy about it, and your energetic field interacts with it. And so that's where a lot of the healing is coming from, is your energetic interaction with the remedy.
Yeah,
and I thought that was amazing.
It is incredible. And all homeopathy is doing is working on the level of the vital force. So, for example, if your kid Scarlett goes out and accidentally cuts their hand or gets a bruise or something, You don't need to tell your body to heal. You come back a week later, there's scar tissue. You come back a month later, there's new skin. So what is that healing energy in all of us that pervades our lives and is there until the time we take our last breath? In homeopathy, we call that the vital force.
Okay.
And that is how these remedies are working. They are just strengthening the vital force because for some reason the vital force got stuck and it's not working as well as it should. And so these remedies are a bit of information that unlocks that healing potential that would have been there if you were completely healthy.
What it sounds like to me is too, because Red and I talk a lot, and Red's a Reiki master, and we talk a lot about DNA crystalline energy, and it sounds like it can help lock those embedments that would be in your system or in your cells. So that way it can open itself to reprogram itself with energy to do new things.
Yeah, and there's a lot of controversy over homeopathy, although if you ever hear anybody tell you, oh, there's no studies on it, that is completely untrue. There have been so many high quality, double-blind, placebo-controlled studies that you can read about. And so there's been
doctor in it, I mean, they say, oh, it's so hokey, it's this, it's that, but how do you become a doctor if it's so hokey or it's this or it's that? They don't even think about that.
And it's written into medical law.
Yeah.
I can practice homeopathy in Washington, in Oregon, in California, where I'm licensed. It's written into California state law that I can practice homeopathy.
Right.
So, yeah, and so there's a lot of controversy because we have been so programmed into thinking in such an allopathic way that we our society, it's funny. I listened to this homeopathic lecture one time, and this gentleman who's been practicing for over 20 years, he said, society is not ready for homeopathy. It is medicine of the future because it works on a quantum physics level. It's an energetic level because we are energy. What I'm doing right now, I'm not giving the listeners physical substance, but they're understanding what I'm saying. This is energy. This is how the remedies are working. And it works so beautifully when you see it. And I see it day in and day out. I'm treating kidney stones, I'm treating infections, I'm treating chronic disease, autoimmune diseases, I'm treating a lot of medication injury. I'm doing all of these things with nothing but homeopathy. I treat babies, I treat dogs. They don't know what we're doing.
No.
So,
yeah. And it's something for people to think about, because I think that that's something that's been drilled into people's heads, especially recently with the FDA and them trying to attack homeopathy as of recently, taking remedies off the shelves, and certain specialized remedies that have been attacked in the past, like teething tablets and other things that have they've been slowly trying to pick apart the fabric of the whole essence of what it is. And I think that's done by a design to get people totally comfortable 100% in allopathic medicine, feeling like a doctor is the only way to your health, when really they're not. By design, they don't have enough time to mitigate the health and healing that you can provide by looking deeper into some of these issues and problems. Yeah. I mean, I think that is something that no one is thinking about.
Yeah, completely. And personally, I see a lot of patients and work with a lot of families, but I have made intro homeopathy classes. So if anybody listening is interested, you can sign up for this class. I made it completely free. In fact, I donated all the proceeds to nonprofits.
That's wonderful.
And there are so many amazing resources
on the website and encourage people to that as a way to let them know about it. We'd love to promote you in that way to help people understand.
That would be great, Scarlett. It was a 3-part intro 101 series that took you through the history and the top 20 first aid remedies and their indications.
Yeah, and I think that that's important right now because, like I said, when people basically have been removed from the healthcare system without a choice, even elective surgeries had been stopped in states. A few of our listeners, especially Bonnie, is out in Snohomish County, Washington. And, she has experienced, being in ground zero with this and being removed. And she's more natural. She's one of we call her our FRN mom because she's always here for our shows and she has a lot to offer. And she's been through many different jobs in her life. So she has a very interesting story. But it's been interesting to see how throughout the country, how people have just had to be removed from health. And then now all of a sudden, are really responsible for their own healing. Like there's a garlic shortage. And they were saying that's because a lot of people have been talking about the medicinal benefits of garlic during COVID-19 and to use it as a preventative. So it's been hard to find.
Love that.
Right?
And you know what, Scarlett? I was, because I work with so many families and I sell kits to my families. They were completely out of kits. I could not order for 2 months.
Wow.
Can you believe that? So, I mean, every homeopathy kit is on back order. I finally found this company in Texas making them, but yeah, everywhere. Elderberry syrup. I mean, vitamin C, everything was out of stock.
Seeds are out of stock everywhere. Yeah. Syrup, vitamin C, colloidal silver. I mean, even Whole Foods took it off their shelves during this time. I found that to be very, very interesting. Everything isn't always sinister, but I felt that was because they were just like, there's no proof. We're taking it off of our shelves.
Oh my gosh.
And it's like, that's been one of their biggest sellers and one of the only places for certain areas that you could find products of that nature. And so, it turns people to more online, which then can get you into shaky ground and territory and you don't really know what you're ordering. But I've noticed a lot of people too have started taking to even making their own, learning how to make their own, just going and trying to go above and beyond these steps to just learn these healing practices that they can bring into their life. Whether that's extra vitamin C, liposomal vitamin C. I've just seen a lot of different people pushing good things that can be really good habits. And I mean, the one thing that I've said too is this is training because in 21 days, they make new habits and they've got people acting in all types of new ways because of this, psychological training that they've been putting on people. Why not start yourself if we're having to start new patterns with something new? Find ways to, I've been a big proponent of gardens. I have 0 land, but throughout the years, I have acquired, different containers. I ended up eventually getting a small garden spot at my apartment. Now I work on a farm and I've convinced the farmer to give me some land to grow my food. And so now there are ways, and I think people need to start reaching out and creating those connections. And later this week, we're going to have Green Guilds, who is going to start the North Star Permaculture Institute, that's going to start teaching people how to do this and how to create these symbiotic, systems of cultures that, who knows, if you end up being interested in something, you can end up being the person who makes remedies in the end and be a company like that. Listeners have to think about what skills could they be good at that could benefit them and their family. And it just starts even just with a small vegetable garden, small herb garden, even if you just have a windowsill. I have a greenhouse inside of my apartment that I'm growing small plants from seed to starters and then putting into my respective places. You don't need much. You just need a plan and to figure out adaptable ways, because that's the best part about using natural medicine. It's very adaptable. You can interchange a lot of remedies. One that doesn't necessarily work, there might be 20 others that you could try in that particular instance. And that's what I think people need to start thinking about, is being adaptable as possible, switching their mental mindsets into one of I don't have to rush out. So many families, I think, have realized too, you don't need to go to the urgent care for everything. You don't need to take your child in for every sniffle and sneeze. We come with a lot of people from the medical health freedom community. And so a lot of them aren't into that. But I've even noticed mainstream turning away from some of these ideas and thinking about what they can do at home to manage symptoms. And the one downside of that, like we talked about earlier, is mental health gets put a back seat. But the one benefit for other people is they start thinking about natural medicine. They start thinking about their health. They might change their diets. They might eat better. People are walking everywhere now and going out for walks. People who never went on walks, even my parents who never walked, they're all of a sudden like, oh, I'm going to take a walk with the dog. They're doing things. So I think this is a time not just necessarily mourn for what was, but let's rebuild what we have and choose the things we would like to see in this quote unquote new world.
And I feel like there's such an awakening happening personally. Yes. I feel like it just because so many people have, well, all of the, items being out of stock, in the back of my mind, I was like, this is actually really good. Yeah. And BG Bumblebee, I make elderberry syrup. Yeah. Like people are making things. They have the time to research. Right?
Yeah, they're making things from scratch. They're thinking about, people are making dinner again because you can't necessarily go out and eat. This is
they're spending time with their family. A lot of families are actually going to homeschool in the fall that I work with because they're like, we've been doing it for 3 months and we think we can do this now.
It was basically a trial without everybody having to commit, but now it's given them the opportunity to see that, it really wasn't as bad as you thought. You can manage, with these new sets of things. You just got to adapt. Like,
yeah,
I have always had chronic illness, and so I have always been either at home or I had to do distance learning when I was in high school because of my illnesses and things. So I kind of said I've been prepared my whole life for this because I really never went anywhere and kind of stayed at home anyway, and always had compromised issues or problems. So I always kind of was at home anyway, so it didn't change too much for me. Like, I run an online radio network. So for me, things didn't really change. For others, it did. And I think that it gives you an opportunity for everybody to reevaluate. People are cleaning things out of their homes. They're just changing habits that I think if we want to succeed, and even if there's going to be a second wave in September, which, epidemiology people say that that's going to happen in previous, diseases, it happens. So it's something to look out for. But I think a lot of people have decided that they're going to take health in a different way.
Yeah, completely.
One thing that I wanted to talk about too is, how do you think that, have you seen personally, even for yourself, an uptick in patients? And one other question I have too is, has your practice had to adopt telemedicine, and what has that been like for you?
Yeah, so, I started out doing telemedicine because I really want to have children soon. And I know that if I want to be a doctor and I want to homeschool, I'm definitely going to homeschool my children, but I need to be an online doctor. And it makes so much sense because I don't have so much overhead. I don't have to charge as much because I don't take insurance. Because, like I said, the insurance model is good for 10-minute visits, but not when you spend 2 hours with a patient.
And it's good for certain quotas, and it's good for certain patients. And if your patient has this, and X, Y, Z will pay you, and if not, they don't. And, it is one of those things where it's a freedom type of situation where it allows you personally as the physician to have the freedom to treat people if you're not taking insurance. It allows it to make more competitive rates. Oh, that's so sweet, Bonnie. Bonnie says you would be a great mom.
Oh, that's so sweet, Bonnie. You're such a sweetheart.
Yes, she's not. She, so she's adopted all of us because she doesn't have children. But like I said, she's
Oh,
with you, and so she is one of our just most lovely people that we enjoy, and so
I
that's a
love
big
it.
compliment coming from her.
Oh,
So
that's really sweet. Yeah.
she's
Well,
wonderful.
you know, I am so thankful for the internet because it allows me to see people far and wide from where I live. I live out in the country, and
Oh,
so
that's
I'm able to see somebody, down in Oregon, 4-hour drive away, and I can see them. And what I actually do is I make people remedies. I have over 2,000 homeopathic remedies in my dispensary, and you can easily make, yeah, in my pharmacy, and I easily can duplicate remedies, and I have videos showing how to duplicate and how to make copies and stuff. Um, and then I mail remedies, so they get to patients within 2 days. And I just think that that's like medicine of the future is
I
online because people are in their home. It's so much easier. They don't have to go anywhere. I work with a lot of kids, autism, pandas. And how hard is it to take a child to a doctor's visit, to put them in the car and to drop them down and to bring all of the
My son has
bags,
a rare
right?
genetic deletion, and so we've had to go to a lot of specialists and visits
Yeah,
of that nature. And it appears mostly like autism or mental retardation is what it's a chromosome 15. So there's only about 250, maybe 600 people in the world who has the same deletion as him. He doesn't have it in a large deletion like the classical cases are usually about 250 MB or larger. His is about 125. So it's smaller, but still there. And so we've had to go through a lot of that. And just thinking about going to the big children's hospital and going to the clinics and having to drag them there and bring them there and what they actually have to do,
yeah,
that it's torturing for these children.
yeah. And I'm so lucky and blessed that with homeopathy, what matters the most is talking to the person or the parent and the individual symptoms of that person. So I actually don't need to do a physical exam unless it's like an acute flu, or I don't need to take labs or I don't need a diagnosis because I'm not prescribing on the diagnosis. I'm treating the individual. So with homeopathy, you're treating that individual person. That's why we don't have one remedy for asthma. 10 people can have asthma, and I give 10 different remedies because Sally's asthma is worse when she's running, and Joey's asthma is worse at night. And they're all so different that you individualize the treatment. And so I'm able to do all of that online very easily.
That's, and I think that is one thing that everything is kind of switching to an online paradigm, which we were kind of excited that we were kind of already in that space and trying to create this online world that people can join and be a part of. So like I said, even for us at FRN, nothing really changed because we were already building that. We want to create a network of people. And that's why we have hosts that are all across the country, have all different types of shows, and working together just under that generalization that it's about freedom. It's about coming together. We need that revolution of people who are going to change, think differently, and be on the front lines of speaking out and speak boldly, and challenge these, whole systems. Challenge the status quo, and be out there to say, hey. And a lot of us were already trying to change it before this, and that's why I say right now, while things are changing, we need to ask for the things we want and move forward with that because of the concerns that I'm starting to have watching personal medical freedoms and liberties kind of go out of the door, under these quarantine policies and tracing and contact tracing armies. Like, what happened to HIPAA and, personal privacy, that kind of is just deleted for apps and for now what is known as, I'll call it, medical metadata. A few years ago at Mobile World Congress, they talked about this idea, and this was like they're a group that has people from the industry of like cell phones, and it's a similar meeting to kind of like the Consumer Reports show mixed with like a Bilderberg is the best way I can explain it. So it's like an insider group meeting that they talk about these trends, and then they pursue them out into the business world over the year after that or years to come. And so they talked about a few years ago coming out with and shifting away from, the metadata of, everyone's conversations and what they're talking about to big medical metadata. And so getting all the information that they possibly could, why there's so many personal assistant devices, Apple Watches, Alexa, all these health-based internet enabled devices, so that they can capture as much medical data as they can and then present either programs or present
advertisements.
Yes, that are now tailored to these ideas, and they're scraping people's personal medical data from it. And now I see it be enacted in just less than 2 years with things like these COVID apps that are in Australia and now on Apple and Android phones that can use Bluetooth technology to pick these things up. In Korea, I thought it was interesting how they did their system, because I did think contact tracing to some degree was smart. Because in the way they did it in Korea was like this. Let's say somebody got a case. They would say there was a male in their 50s who crossed 15th and 21st Street at 4 o'clock. If you were on 15th and 21st Street at 4 o'clock, you could have potentially been exposed to COVID-19. And that's all they would say, and they would send this out into the geographical area where these people would be, or if your phone pinged in that area. And that's all it was. And this is how people in Korea, South Korea in particular, were able to keep numbers down, know who could be potentially exposed, because then if they knew they were in an area that was a hotspot, or know they passed by maybe this potential person, they could treat themselves as exposed, reduce contact from people, and then hopefully not be an asymptomatic carrier for 2 weeks and then move on with their lives. And I think that was something that the United States and other places just really skipped over and missed, and went to this extreme level of intrusive data. Instead of just using basic, simple, common sense information, in the beginning, they only gave a few, this store maybe had an employee or this or that. And then they stopped really talking about that at all. But now they want to have these secret contact tracing armies that they really don't tell you about what they're going to be looking into, how they're going to tell you these things work, what it's actually going to happen. What happens if they do find someone? Then what are they telling people? Are they telling people to quarantine? Are they telling all the people around them? How do you decide who was their closest contacts if definition is more than 15 minutes within 6 feet? These are the concerns that I have. Instead of just telling people in an overview, like I said, like Korea's model, this model seems like it's going to be potentially highly restricted. Could be similar to, I think it was SB 262 in California. That was the law by Senator Pan where they could confiscate your items and come into your home if you were quarantined, and the public health officers in control. That allows the door for those type of programs to be implemented, and things like HIPAA go out of the window, and people are screaming it's for the greater good. That concerns me.
Yeah, completely.
People are willing to throw away rights so quickly and just basically throw their neighbors under the bus. I know a lot of people have been talking about this is similar to Nazi themes, but it is. I studied the Holocaust in my younger years, and it was one of my specialty subjects in school that I did a lot of research projects, read every nonfiction book I could on the subject. And this is the same thing. They got people's, even down to a neighborhood level distrust. So then they would be willing to turn on people because they felt that it would be better for them if they did this in the long run. And that's how people are now treating this disease. You are either, if you get it, you're a leper of society. No one wants to be around you. No one wants to interact with you. Even my friend's mom, who was in the hospital for a gallbladder surgery, she kept testing positive, and they wouldn't let her out of the hospital. And they're like, no, you have to stay here. And she had been healed for weeks at this point. And she was kept in the hospital for 9 weeks. before they let her go, and they had to send in the National Guard to do a test. So 4 men in uniform came into her room and administered a COVID test, and she finally tested positive, and they let her go. But before, they wouldn't even let her leave the room.
Wow.
For 9 weeks.
Wow. And the thing is, Scarlett, is that fear, that's what it is. Fear controls the masses. And that is why when you turn on your regular news station, they're just pumping you full of fear. I mean, all of our news stations out there, mainstream news, are owned by the same company. The
same 8 groups.
The same group of people who all talk to each other. And so fear is what controls the masses, and they've been pumping people full of so much fear, not talking about natural medicines that work.
Silencing doctors.
Silencing doctors. And Scarlett, I can't even say treat or prevent COVID. I actually am not even allowed to say that word, even though I have. Well, I'll just say that a couple patients have fully recovered, but they are just pumping us so full of fear because fear controls the masses. And what we need to do is we need to educate ourselves, empower ourselves to not be feared, to not live in fear, because that is when people give up their liberty, is when they're so scared and fearful.
Yeah, we can't let people live in fear anymore, because there are ways from, simple cuts and scrapes and bruises. My little one had gotten on her bike and tried to jump off the back and got in the wheel, and she's like, it hurts. And so I was like, okay, well, let's see in 5 minutes if it hurts. And, it still hurts. So I was like, well, let's try some arnica. Let's try that. And, within a few minutes, she was just right back to her own life and doing things. There's something that I think people need to just slow down and think about. Everything we know about medicine at this point needs to change. Everything that we thought we knew, everything that we've gone by as a rule book needs to be thrown out of the window at this point.
Yeah.
Something like COVID-19 has changed the way everyone practices medicine across the board. And that has to do with, and FDA compliance, was there way before that. But I think that's a way to silence, because they cannot patent natural plants. It's a way to stop the conversation, because they know they can't patent these things. They can't come up with the drug. If they create a chemical synthetic derivative, they can. But as far as promoting it or marketing it, they can have no control over people taking control of their lives. So thereby they figure, well, let's just silence the speaking of. Okay, so you can't say treat or prevent, even in the essential oil world. You can't say these things because that's
As a doctor, I'm a doctor of natural medicine, and I can't say treat or prevent when it comes to COVID.
Crazy. Yeah, and no one should have been, and they sent out this blanket letter to all the physicians in the country and basically let them know, you're not going to be able to say these things. Yep, you're not going to be able to talk. We're going to gag you, and if you do, we'll snatch your license, and we'll make sure that you're not able to say these things. And I think everybody should be appalled that doctors and hospital systems across the country are going to shutter. They're going to close. They're already furloughing their workers. They're already getting rid of people. They're already, hospital parking lots were half empty. I went by a popular hospital that usually has a completely full parking lot, people bustling. Even the employee parking lot was half full. And that's just one of 12 metro hospitals in my area. So what do all the rest look like? Yeah. And that should concern everyone, that if all of a sudden we're going to have a serious shutdown of hospital systems, it's going to leave millions of Americans vulnerable with no allopathic medicine coverage, which to some people could be life or death. And they're not thinking about these consequences that they have created for everyone under the guise of, well, at first they told us 2 weeks to make room in hospital ICUs and things, which that made sense to some degree. Let's try to build out these spaces and areas. If people are getting sick in droves and we need areas, and especially, we need to make sure they're airlocked, and we need to make sure that they have, certain protocols. Yeah, give time to build these things. But they built some of these things in places where, $21 million and they were never used. Field hospitals and, separate wings, and they cleared out hospitals and they cleared out nursing homes. And now they're starting to put people in nursing homes for care. Why aren't we, and we still, if we look at the numbers with the, the U.S. Hospital Association, with the number of beds and then the actual available beds, there's still available beds. Thousands and thousands of available beds. We have not reached peak in most places of the country. A quarter of the country has no cases whatsoever. And we're not thinking about that right now. What does that do to the hospital structures when they're not receiving funds, they're not making insurance claims, they're not getting in patients? How does that affect the whole structure? And I think that it's going to be a domino effect of just holes in the structure that I don't think people are even ready for yet, that we could see more people die as a result of hospital policy and structure just failing because they can no longer function because they're not getting money in, rather than the virus.
Yeah, completely. And what we were discussing, how this has changed my practice, because in the month of March, I was so incredibly busy, because what I was doing is I was sending out care packages of 6 remedies that I had researched from my homeopathic colleagues, the number one being Dr. Erin To, who is a professor of homeopathy in China, who is presenting cases of COVID using certain remedies. And so I was actually putting together over 50 or 70, I don't even remember, care packages. I didn't get any sleep in the month of March. Just because I was so incredibly busy. And in homeopathy, you have to match the symptoms. So I made this whole document for patients going over what these remedies do, how to take them. And I actually was giving all of my patients homeopathic coronavirus, the same novel coronavirus. And this is the field of homeoprophylaxis. And this is a field that I really love. So basically, I cannot say that this prevents the coronavirus, but what I can say is that when you take this, think of it as a bit of information that educates your own immune system. And there has actually been so many studies done. The biggest study coming out of Cuba on 2.2 million people, showing an 84% reduction rate compared to vaccines in reducing the number of leptospirosis cases using homeopathy. And so this is a whole field, and this one vial that costs so little money, $20, you can turn this into 1 million doses, because you just put it in water and you dilute it. And this is why this is used in Cuba and India and other third world countries, because it's so incredibly cheap. There's no need to refrigerate. There's no need to have syringes for vaccines. This is orally. And this has been shown to be so much more effective at preventing disease than vaccines ever will be. But yet, why aren't our health agencies in this country studying this and using this and utilizing this for people? Because it makes no money, because it's so cheap, and because it works so well.
Well, and they even said this with the COVID vaccine. They said, previous coronavirus vaccines, I watched a video from Dr. Fauci in previous lectures he's actually talking about SARS-CoV. And he was saying that the reason why there was never a vaccine created for SARS-CoV was because there was no financial interest in making the vaccine at the time, because they couldn't make enough money and get investors to get involved in it. And so if people don't think that money is a direct correlation to what remedies get created, what things get put into the market, how you're treated, you're highly mistaken, because that was even when, that was the big deal. People talked about this. It was a huge issue. And to know that the so-called players of the world were sitting there and saying, nope, we're not going to create that because we don't find financial incentive.
Yeah.
That's how most medicine is presented nowadays, is for a financial incentive. There is someone along the line pushing these things to fruition for a big pharma or other entity. There really is a hard time, and that's why I think naturopathic and more natural herbal medicine is coming back, because you find more honest people, you find more people without financial interest and motive in these categories, and that's what's attracting people, because they're starting to see. I think this is the first time I've seen public distrust in the CDC or the WHO, ever. Besides, groups of activists that, were supposedly small groups, but now we're hearing in articles that, oh, they actually might win this time. They might take over. The narrative is shifting, and they're admitting that people who have challenged their quote unquote science, and they've been using this, oh, believe in science, as a way to try to out idea someone. But really, the science isn't there to support them. They claim peer review is the greatest thing, but the way the peer review design format is at this point is engineered, again, for special interest.
Yeah, and Scarlett, they are, and like I said, there has been so much science. There's been over 20 peer-reviewed studies looking at the effectiveness of homeoprophylaxis.
Yeah.
And that is something that they are refusing to look at, because there is science there. Anybody watching, don't take my word for it. Go and research and read the studies yourself. But the thing is that, when I got, and this is actually a remedy made out of the novel coronavirus, so the new coronavirus. And so what we have to keep in mind, and the biggest thing I want your viewers to take away, is that no matter what virus or bacteria or parasite or whatever comes, whether it's man-made or nature-made, you can always turn that into a homeopathic remedy. This was on the market within 2 weeks of this outbreak hitting China. That's how fast these homeopathic pharmacies are at making remedies. And this is a way that you can educate your immune system very cheaply, very safely, so that if you encounter that virus or that bacteria in the real world, it will not resonate with you, because you've already gotten that information. You've already gotten that signal. And that's how these medicines work. And they're, so I was so busy sending this along with 5 other key remedies that Professor Aaron Toe were using on coronavirus patients to all of the families I work with for very, very, not that much money at all,
Well, and I think anything at this point with, we have to think about health and the cost. And when you even think of just about an allopathic visit, it costs much more than using remedies, and in the long term. And the deductibles that most people have are extravagant compared to costs of, simple homeopathy visits and simple, interactions with herbal medicine. So I think that people are concerned at first, but in the long run, if you're healing your body and treating it, it is better than continuous visits over and over to the allopathic doctor that really is only ending up costing you and could potentially ruin, your credit or your life due to continuous visits. When you think about something about like homeoprophylaxis and the fact that they won't even look into it, but yet we know that vaccine injury is real. We know that it happens to millions of children across the country and millions of people in the world. And the fact that they won't look at something that would not cause side effects, that no side effects whatsoever, is baffling to me, that they would take.
And there's science behind it. There's a lot of science behind it.
And we know that people are using this, and this has been a trusted form for many different groups and people. It was interesting to see that China did in the beginning go straight to Chinese medicine and herbal medicine and homeopathy, and India's Center for Homeopathy was cranking out ideas and doing tests and studies. And when you think about, they're still trying to create and never have been able to create a vaccine for coronavirus, but yet homeoprophylaxis was able to be created within 2 weeks. Why are we not looking at that superiority of effectiveness? Just streamlining something to market.
And I just wanted to add, Scarlett, I'm sorry, I get so excited. I'm like, I know. Why are they doing that? Because it doesn't make sense to me.
No.
But in Brazil right now, I've been in touch with this amazing homeopath, and she's a PhD pharmacist down there. They're actually making the coronavirus remedy and giving it to millions of people. They're conducting their own study right now in Brazil that will be published in a couple of years. So
that would be great information to have, just because Brazil is being hit quite hard right now. They are second in the world behind us for coronavirus cases. So it has been a big issue and a concerning issue and a compounding issue in Brazil, that I think that if we don't, as people, if we just think about, coming together, or if we want to frame this as a war, why would we want to throw everything we could at it? Why wouldn't we want to take every idea, every type of herb, every type of even allopathic medicine, vitamins, amino acids, just anything we could think of to try to throw at this? And I've been shocked that, and we've all known that this is how it proves, to me especially, that this was all by design. Because as soon as it came out, it was vaccine or nothing. Basically, my governor came out to say things won't return until we get a vaccine. That is really disappointing to see that is the only way, when there are so many more options for people, and we're just being taught that this is it. This is all you get, and either you take our vaccine and you go along with the program, or you're going to be removed from life. You're no longer going to be able to interact. It's almost like a Chinese social credit score. That's what concerns me, I think, more than anything at this point, is it's turning into a social and construct of control, rather than just, we're trying to keep you safe medically.
Completely. And what everybody listening, and I do think that there's a huge awakening, people who, the movie Plandemic with Judy Mikovits.
Yeah, we talked about it here.
Okay, great. Okay, because when that came out, well, obviously it was all over my Facebook feed, but it was all over my husband's Facebook feed, and he has nothing to do with medicine or natural healing. It's all car stuff on his feed. He's a car guy. Yeah. And it was on his feed. My mother-in-law sent me that movie. A friend that is very allopathic posted it on my husband's feed. And it's like people are waking up, because the vaccine issue, if you want to go get vaccines, great, you go get them. Like, I will be here if you need help detoxing, because that's what I do for people. But if you want to get them, get them. But people are waking up to, the issue is not vaccines, it's medical freedom. It's freedom to choose what is injected into your body. And I think people with this whole situation, and they're rushing this vaccine, they skipped animal safety trials. It's an RNA virus vaccine, which had horrible, horrible results when they tried to do this for the SARS back in 2012. It actually killed all the animals that they gave this vaccine to. People do not want this vaccine, and I'm seeing it in groups of people who are extremely pro-vaccine and very pro-allopathic medicine. Because now, when it comes to their own bodies, like if it's their kids, it seems like they don't care. You know, that's why all of these vaccine laws have been passed so easily in public schools. But when it comes to their own adult bodies, you need to get this vaccine in order to go to work. You need to get it in order to go to the grocery store or be part of society. That is when people are finally starting to wake up to the fact that it's a freedom issue, it's not a vaccine issue. And I really do think that that's happening, and I'm hopeful, and I pray all the time that more people are waking up. So I'm really hoping that our humankind can move in the direction of freedom and empowerment from this whole situation instead of into kind of a slavery state, which is where it seems like our government and the Bill Gates of the world wants to take us.
Well, yeah, and especially with things that they created like Event 201, they had already kind of planned for these things. You know, I think people are waking up, especially with things like the hydroxychloroquine, right? When people were told, you know, hey, this is working, and now they're told it's not. And they're seeing that struggle where they're questioning, well, why can't I get it? And it's a cheap drug. And if it's working for people, and like the hydroxychloroquine and the Z-Packs, people were seeing that this was working. It's a simple medication combination, and now they're told no. Now they're told yes, but then they're told it's an essential medicine. Now it's removed off the essential medicine list by the WHO. I think they're starting to see the inconsistency in their message. And I think this is a good time to keep pointing these things out, that they're inconsistent with their message. They cannot give definitive answers on anything, but yet they can tell you for sure what they don't want, and what they haven't done, and what doesn't exist. But they can tell us, oh, but the vaccine's coming, and we can just hope and pray on that. Well, what if that falls through?
Yeah, or remdesivir,
Yep.
which Fauci has invested monetary interest in that drug.
Right.
You know?
Why are we, and now we're using it for supposed compassionate use, and some of the trials have been stopped, and Gilead can't make enough doses because they put all their eggs in one basket instead of allowing many different drugs or many different things to be going on at once and being tested in clinical trial. They only allowed their specialty products to be in clinical trial. The people they chose to create the test to be in business for tests, instead of using many different people and actually using American ingenuity to do it. You know, what ended up happening to GM and all these other people building ventilators and doing all these things, and then that just kind of fizzled out. We were supposed to have all this great innovation, all these great ideas that were supposed to be focused together. And I just found it interesting that we actually had that happen, that we just kind of lost the opportunity. But I think we can gain it back. I think right now is the time to, you know, share with your neighbors, share with your friends. Like I said, start planting gardens, start, you know, using herbal medicine, start reading about it, start looking into homeopathy. If you know nothing about it, I think now is the time to start looking into it. They're sold in many different places. Kits, I think, are the best, most economical way to get remedies because you get multiple remedies at once. But if you have to, start small at a local health food store with 1 or 2 remedies that you know that could help with some ailments that you know of. You know, one that I think has been super common that's really kind of risen to the higher rank, so to speak, in everybody's idea of homeopathy is arnica. You know, it's found in cream, it's found in lotions, it's found in gel, it's, you know, there's lots of different forms and versions. And I think like if you could start with 1 and that's all you could maybe get, it's not a bad choice.
Yeah, completely. Bruises, scrapes, kid bumps their head, you know, kids get knocked off a bicycle.
Yeah, one of our hosts, Red, actually treated her son. He was actually ran over by a car in a truck, and he had a level 4 liver contusion, level 4 lung contusion, broken ribs, broken shoulder, very serious injury. He was life flighted, very serious injury. And after like day 3, he didn't want the allopathic medicine anymore after that. And she went to like arnica gel and arnica cream and arnica the actual remedy in, I believe, want to say like 60 and 30, and then ended up getting 200, and used that to manage his pain from there on out, where he didn't need any other allopathic form of pain management besides he did use kratom, and that was actually approved by the Colorado Children's Hospital, and they let him use that because he fought them from taking the allopathic. They wanted to give him oxycodone, and he didn't want it. And so she totally treated him through natural medicine and used no allopathic medicine after they left the hospital. And he was out of the hospital within 5 days.
That's amazing. And one of the reasons I love homeopathy is because it does not interact with any supplements or medications or any anesthesia or anything like that. So for patients going into surgery, I'll actually give them arnica and ledum prior to help with the surgery. And it's very incredibly safe medicine that doesn't have any interactions because it's all energetic based, and it's like a download file of information is what you're getting. It's not physical substance.
Yeah. You know, I had some issues with like indigestion recently, and so I was looking through remedies. I'm like, what can I use? And then I have another one that's like the complete home book of like remedies that, you know, has a few different, how you feel or what it could be worse, what makes it worse, or what kind of, you know, you find better. With one of those, I looked up a few remedies, and then I was able to, you know, literally within like a half an hour, it was, you know, over and done, and I was through it. And it just took the time of actually looking through it and spending some time and doing some critical thinking and thinking about how do I actually feel. You know, when you make a complaint such as my head hurts, what about your head hurts? What about what areas? You know, is it a front?
Where does it move?
Yeah.
Is it achy? Is it stabbing? Is it pulsating? Right? All of those different things lead you to different remedies. That's why there's no one remedy for headache.
No. And so I think that it also, when you're using homeopathy, it allows you to start breaking down your conditions, and it allows you to start having a more holistic view of speaking about your health, because you're going to have to describe what's happening to you. And it's not just going to be as simple as, well, my tummy hurts or my leg hurts or this or that. It makes you really think about, first, especially too, what mental status you're in. Because, you know, if you're in a more fearful state, there could be something better for you than if you're not. These things all come into play with how you would heal yourself. And I don't think we've focused enough on that. We've just been a society to treat symptoms. We must just treat the symptom. We cannot treat the whole person. We cannot treat the whole problem. We cannot treat everything that's happening and could be happening in their lives, why they feel these symptoms. We're just going to treat, you know, everything and anything. And, you know, like they've been saying, there's been an increase in prescriptions for like Xanax and anti-anxiety medications. They said that has went up in an increase of at least 50%. And that is a concerning thing for me, that they probably are prescribing this without seeing patients. They're probably just having patients call in, and then they're prescribing these things instead of thinking about, well, what should we do for you as a person first? Where are you in your point in life? And then maybe not prescribing something for everyone, and especially going straight to something like a benzodiazepine. There's a lot of other choices that you could maybe talk to people about before you jump to the benzodiazepine. But yet they talk about the opioid war, they talk about, you know, all these drug wars, but yet now during coronavirus, they're willing to bend their own rules to then drug Americans into submission once again.
And you know what? I have to tell everybody that, oh gosh, anxiety, depression, so easy to treat with homeopathy and flower essences. And I just wanted to tell everybody at home. And I actually made a flower essence blend for myself that I've been using. And I have like the whole box kit here. In no way do you need this whole thing.
Wonderful.
I know. I'm a doctor, so I have to have it because I make blends.
Yes, and I would have to have it too, just because I need all the cool things.
I know. Well, hey, get in touch with me if you need any, and I can help you. But I was just going to tell everybody at home, Rescue Remedy is like so amazing. And you guys can buy this at the store. It's amazing for anxiety. I know that, personally, I deal with anxiety because of what's happening, because I'm dealing with so many people with anxiety. It rubs off on me.
Well,
And
yeah, the fear of other people, they're coming to you probably scared. They're coming to you
yeah.
they're coming to you with all types of things that they're just kind of unloading on you at this point because they don't have anyone else to help mitigate these issues.
Exactly, Scarlett. And the two things I'm doing the most of, Rescue Remedy, if you get this, I'll show you guys a trick. If you have a glass of water, literally just put 5 drops in here. So this little bottle is going to last you forever. And then this whole water, you can sip it throughout the day, and it helps so much. And so Rescue Remedy is an amazing, it's $15. It just, I mean, I've had so many people tell me, gosh, I was going to have a panic attack. I took this and it completely went away. I've heard that so many times.
I used Rescue Remedy a lot during my pregnancy because I had a lot of anxiety, and I used it in the spray, and then I had the pastels because those are just nice as a little treat, give you a little sugar and kind of have a good taste to them. And then they even do have some night ones now too in Rescue Remedy.
Yeah.
And even for pets, they even have a pet rescue remedy too. So if your pet has a lot of anxiety, which I think a lot of pets are having issues too because their owners are upset, have anxiety.
And their anxiety. You could just put a couple drops in the pet bowl. It's the same thing.
Yep, it is.
Doing that and grounding. And I cannot tell you enough about how amazing and free grounding is. I mean, it's free medicine to get out on the dirt with or the grass barefoot. You're actually getting the earth electrons, and it's actually been shown in, again, over 19 published studies that you're actually gaining free or antioxidants from the earth in the form of free electrons that quelch inflammation, quelch anxiety. So grounding, Rescue Remedy, homeopathy. I mean, that's my trio right now. And especially with all this 5G, Wi-Fi, all of these signals, we need to ground, we need to connect with the Earth's energy.
And with the grand solar minimum too, we have a thing called the grand solar minimum, which has cosmic ray flux coming into the universe, which is also affecting our energies because our Earth's magnetosphere is waning and weakening right now, which is allowing these space particles to come in and hit us a little bit harder than we're used to. So that is also playing a huge role in what's happening to us currently, as well as the fact that in previous grand solar minimums, other diseases have popped out of nowhere, much like novel coronavirus. So it's interesting to see that we're again going into that time, and we're now seeing this again. The Black Plague happened during a grand solar minimum. When the sun's rays stop being as strong, when the cosmic ray flux increases and hits our Earth, we start seeing a lot of energetic disturbance. So we have energetic disturbance along with them artificially creating energetic disturbance, which is creating a unrest and unease. The one nice thing about it is we're seeing an increase of Schumann resonance, which is the Earth's heartbeat, which is the energetic energy that we exchange with one another in creating what is known, like I said, as the Earth's heartbeat. That can be known as an indicator, and some people think that, and there's been people like Heart Math Institute and other groups who have researched this, that it could be the collective energy that wakes people up. It's been shown that when Schumann resonant energy spikes, we see spikes in information and spikes in changes of learning. And like after the Las Vegas massacre, during that time, we saw huge spikes of Schumann resonance energy where people were waking up to these ideas and waking up to these narratives and waking up to the corruption. And every time for the last 2 years, we've been seeing increasing spikes that we've never seen to this level. We didn't even know it could go so high. So there's something happening between individuals right now, of which I do believe there's an energetic shift. Just why people, more people aren't dying in general. We're not hearing about it. Like all of a sudden, people just stopped dying from everything. And it's not just because of record keeping either. I do believe there's just an energetic shift in the way people are actually manifesting the world around them that's allowing this new sense of life and new sense of health, and just kind of changing how people are interacting. We've been seeing less crime. We've been seeing less disturbances. Things like, yes, domestic violence and other things have increased to some degree, but at the same time, too, we're not seeing as much disorderly conduct between people. We're not seeing as much, just overall crime, burglaries, we haven't been seeing as much. It's been an interesting time that all of a sudden people kind of remove themselves from the patterns and behaviors that they were involved in before, and people kind of just stayed at home. They kind of started new habits. They started doing new things, and kind of the underworlds and other places have kind of faded into the background, and we're not seeing that as much. So I'm wondering, if is it not a true energetic shift in people, of their consciousness, of their awareness, of their true intention? Is this the time where the earth shifts for the better purpose of people really having the greater good? Has people manifesting and working with the law of attraction for so long shifted us into a pivot point, where we can kind of take things back? And if we choose to take that back in the guise of individual freedoms and the things that we can control that create freedom, such as growing your own food, having land, raising animals, getting into plant medicines, getting into cooperatives and sharing with other people, sharing knowledge. That's why we do this broadcast, free of charge. There's other people who charge and have, other ways of getting the information. But I think that right now it's so important to try to teach people on a broad scale what this is, and try to get as many people as possible involved in whatever way sparks their interest to have their personal freedom, their freedom revolution, their idea of what it means to them, what it's going to look like, and how do you create happiness and joy, even if there is a new normal. Because I think that you don't have to take it as a death sentence to the old world. The old world sucked. We all complained about it, okay? We did. We were mad about it. We didn't like it. So, it's time to just kind of let that go.
And change is always hard. Change is uncomfortable. Change brings about a lot of uncomfortableness, but that is
taught to repress. We've been taught to repress being uncomfortable. We've been taught that, it's not good to feel uncomfortable. We need to mask it with a pill. We need to hide it with this. We don't need to show it, because that's how kind of society's been made. Right
but
now.
Our level of suppression is not sustainable. And what's happening is the veil is being lifted. People are waking up. People have more time to research, to think, to be clear, to spend time with their families, to reevaluate what's important in their life. I know, my husband has been at home. He hasn't been working. His job was closed, and gosh, it's been so amazing having him home, just, spending time together. Yeah.
Doing things that you never thought that you would maybe do together.
No.
For some people, it has increased and created better relationships, where just because certain topics and certain relationships where you were forced to confront it. You couldn't hide from it. You can't get away from it. You'd have to find new ways to deal with it. And I'm sure you can deal with it in a negative way, but you also can think about, well, what positive can I turn out of this? What can I do to ensure that this isn't just a negative experience? And I think for a lot of people, there was an article, I believe it was in Forbes, that was like, some people are thriving during this lockdown. Not everybody is having a hard time getting through this. And I think that's important to also focus on, is that there are people who are thriving, who have found their place through this, have found, what they're good at or what they like doing, or have found ways to help in their community, or just as communities, they've become more connected. there's been a lot of division, but I also think if we're building new fabrics and new paradigms, some of the old people are going to have to follow away to make room for the new. And I think that might be more what we're seeing than just divisive division. It might be a reorganizing of new fabrics and new levels and new enclaves of society.
Yeah, completely. And like we said at the beginning, I really do feel hopeful, and I hope that people can wake up and that our world can be in a better place when this is all over. And I do feel like that will happen. And at least for myself, and I kind of live in a bubble because all the families I work with think like me. That's why they find me, you know. But I do feel like people are changing and waking up, and it's a really exciting time to be alive. And glad that I know this information and can share it with people. And for everybody watching, I make a lot of free videos like you do,
Yeah.
Scarlett. I have that free homeopathy 101 class. I'm also working on a amazing project that I'm going to announce soon that's going to be completely free. And I'll let you know, Scarlett, so that you can tell your viewers.
Yes, and we can, because I want people to be able to get connected and find the tools.
Yeah, and I want people to empower themselves. I want people just the most, like, I feel like I was put on this earth in this life to really spread the message of natural medicine and homeopathy to everybody. And when I give out information, I see it come back tenfold. That's why I do this. It's a personal satisfaction. And I'm sure it's the same with you, Scarlett.
Yeah, it's planting seeds with people so that they can find ways to support themselves, find ways to have freedom, to have hope, to when you're empowered and when, like Red, she lives off grid, no electricity, no running water. She has, like 40 goats and like she lives her life and she's independent and she's happy because she's created the place where she feels comfortable. She's created a place that isn't necessarily cookie cutter by society or what society may approve of. It's what has worked for her. And I think more people are kind of finding their groove in that right now. And we don't have to be stifled by the rules and regulations that are occurring. We can create new paradigms, new groups of people to kind of break through that and show people there is a better way. We don't have to focus in fear. We don't have to live in the old society, but we can connect with each other, try to find our people. Like I've always said here, vibe with your tribe and find them. Then going forward, you try to bring everybody else in with you in what they're good at. And so then eventually it's like the 8 degrees of the 8 laws of change. And then 8 laws of change says that you can take like 10% and put an idea out there. And then if you just have 10% saturation, it can come back and change and create a whole movement. And like Bonnie says, the new paradigm reminds me of being a kid in the 50s. It was so simple and natural. And I think that that's what is the key. It does not have to be complicated. It does not have to, you don't need to necessarily have the most extensive research there ever was to just start being natural and more holistically minded. It just takes willingness to understand that you let your body do what it's actually meant to do instead of trying to intervene with chemicals. Let your body find its way of healing. Let it find itself to get you back to the homeostasis that you deserve.
Yeah, I love that. I love that so much. And I couldn't agree more. And thank you so much for having me, Scarlett, on this show. And I would love to be on again. And
definitely on again. And we could definitely talk about maybe getting your own show. That would be nice too.
Oh, that'd be so nice. Yeah, I would love that. And well, the really, really exciting homeopathy event. I'm so excited for it. I've been working really hard at. I will let you know so you can tell your viewers because it's a way to learn homeopathy free and have a lot of excellent speakers and everything. So.
Well, and I think the more people who come together at this time, that's why we're considered a network. We call ourselves a network. People who we work with, we call Friends of the Revolution, because I think the more people that we can get who are out there working together, understand we're all on the same page, we're all on the same mission, we're here to support each other, and that together we can be more effective than individuals trying to work in ego. And we can work through a place of, we really just want to help people get to the best them that they can possibly be, and finding that and making it simple for people. I don't want people to struggle. I want people to find it to be like second nature to them with whatever that is. Like I said, whether it's medical, whether it's, with homesteading or living an off-grid lifestyle or living in the city or whatever it is. That's why we have many different people here with many different backgrounds and ways of life, because we can show people no matter who you are, we can come together and you can control how your health is important, but you can also control many other parts of your life so that we don't allow the government to take over everything that we know to be as individuals. Individual liberty and freedom cannot disappear over a man-made hyped virus, whether that's natural or non-natural. The hype is real, and we can't let them take everything we know to be true away from us. So let's try to hold on to that and figure out ways together that we can do that. Would you like to tell everybody a little bit about your clinic and kind of what you do and things that you would like to promote so that they can either get in touch with you or contact you? You talked about a few remedies tonight in homeoprophylaxis. Maybe they would want to contact you about purchasing those things. So how do we do that?
Completely, Scarlett. Thank you. Well, you can give everybody my Facebook page, just because I post so many videos. I have my personal Facebook page, and I've reached my friend limit, and you can certainly follow me there, but I post the exact same thing to my professional page, Anna Jackson ND. So you can tell everybody that link. And then as far as my clinic goes, I am licensed in Oregon and Washington and soon to be California. Unfortunately, I'm really limited that I can only work with people in those states given the medical laws that exist. But if you're in that state and you want to work with me, I see people online, and I provide them with homeopathic care. So anything from the flu to autoimmune illnesses to vaccine injury. I do a lot of that with kids, kind of the whole gamut. But
which is so wonderful for parents, because I know that especially vaccine injury in particular is a specialty that there's not a lot of people out there who are working to help families and kids and looking for solutions. And so I really appreciate that that's been something that you've gravitated towards and decided that was important to you to cover that area, because I think it's an undercovered area in many places. But especially in Washington and to be in California, where a lot of draconian laws have come into play, I think it's an important place to be. And you're right. I think you are in the right place at the right time, treating with the people you're supposed to be around, almost synchronicity, because those places are being hit the hardest.
Yeah, completely. And my heart goes out. I mean, I can't tell you how many tears I've cried over the kids that I've met and I've worked with. And I've actually had to I do so much better now. I can talk about it without tearing up. But yeah, I love working with families. But even if you're not in that state, you can, I try to educate people as much as I can. I have free videos all the time on my Facebook. On my website, I'm putting new videos under the teaching tab. So just like you, Scarlett, I'm just trying to get the word out there. I didn't take this path to make a lot of money. If I would have gone the allopathic route. But really, my purpose here is to teach and spread the information. And that's the most important thing that I can do, is to empower families to take control of their health, and nothing means more to me than that. So,
So we should ask everybody before we get out of here, does anybody in chat or out there in the world have a question for Dr. Jackson here before we get out of here tonight? I'd like to let everybody, if they do have a question, have a chance to ask anything that they'd like to know, and or something that they've been curious about, or something that we might not have covered in just a general manner. But I think that if this has inspired you to look into things, you should start using some of the resources that we talked about, looking at some of your videos, just maybe getting an introduction. If you know nothing about it, just start somewhere and then see if that, just try a remedy. You never know how that could help you in the long term or long run, and it could be life-changing for you.
It really could. And you know, the Homeopathy 101, the free class I did, the 3-part class series, just email me. I can send you the YouTube files. They're hidden right now. But, you know, but just get in touch with me. I have people
over here, so we'll make sure it doesn't go down.
Perfect. Okay, good. I had 180 people sign up. It was incredible. And we raised $3,800.
Good for you. And that helped other, you know, nonprofits and other people out there.
It went directly to IPAC, who's doing the Vax Done Vax study, to ICANN, Del Bigtree Show, and then Children's Health Defense.
Yeah, I've got to meet Del Bigtree a couple times doing what I do here, and I have shown people many times this book that I got to meet. And when I was in Alexandria, I got to meet Del Bigtree and got to get his signature. So I got to meet him
great.
In my career. I got to interview him for the first Vaxxed movie, and I got to interview Dr. Andrew Wakefield, and I got to meet Polly Tommy. And then the second time in Alexandria, I got to interview Del Bigtree again and just kind of see his perspective after a few years down the line, how he felt, just how his perceptions had changed, and now going to, you know, ICANN with, you know, basically becoming a powerhouse and going after this and showing it in, I think, a professional way that has allowed us to have a room to stand and a leg in the argument that they cannot chop off, and they're upset about it. They do not want us to have skin in the game on this, and I think
I know. And now they're like, COVID, because they know that they're backed in a corner.
They are, and they know it, and that's why they said they believe that, you know, even that the anti-vaxxers might win this because they know their science isn't sound, and they know that something is changing, and whether that paradigm is because it's our time as humanity to shift or not is really important. And Bonnie had a question, was what could one thing that all people with autoimmune could be beneficial to know?
Okay, Bonnie. Well, I don't know you, Bonnie, but it seems like you are very in touch with natural medicine. And with autoimmune disease, you have to have a healthy digestive system. That is number one. And so eating bone broth, glutamine-rich foods. Glutamine is the number one food for the lining of the small intestine. Fermented foods. I'm not a fan of probiotics. I'm actually a fan of fermented foods because you get the enzymes. You get vitamin C with sauerkraut. You get all of the cofactors. 1 tablespoon actually contains 3 trillion bacteria. There is no probiotic that you can buy that has that amount of bacteria. So with autoimmune illness, I think of number 1, the gut, and then number 2, the mind. How are your emotions? How are your anxiety? How do you control your stress? Because that's not looked at in the allopathic world. And having tools that help you, whether that's rescue remedy or grounding or journaling or doing something you love, giving back to society, that is very, very important to feel like you have a purpose. So yeah, the gut and the emotions with autoimmune disease.
I think that is important because I think that's one thing that we've removed. We've been such an industrialized society that we've removed checking in with our emotions and making sure they're intact. And that's one thing that I think people have had to think about. What is happiness? What do we really enjoy doing? What does our world
what
look
gives us purpose?
Yeah. What brings you joy? Yeah. And purpose, I think, has been restored in a lot of people who have found ways to go around the traditional ideals. And it's been a beautiful thing to see others, maybe struggling, others are thriving. I think if you see someone struggling, try to lift them up. um, Try to interact, try to reach out more. Let's not lose that genuine human kindness and touch. Let's not sterilize ourselves into our own bubbles. um, but let's reach out and still try to be helpful and be that community that we know we can be without losing the elements that the government is trying to get us to remove. They want children to be 6 foot apart at school. They're creating all these new CDC regulations that basically sound like prison. And it sounds like humanity being removed. And we're group beings. We're people who need to be around each other and with each other. Removing that, I think, removes all but what makes us. And we cannot do that. So, as I always tell people, remind yourselves to be kind to one another. Remind yourself to just interact with maybe one person a week that you wouldn't normally, and try to just have kindness, show kindness. Try to think before we overreact at these times. A lot of people have, been edgy, and I understand, but I think you giving that one extra moment that you put into play can create a butterfly effect that we can carry through, that we continue to see progress. We continue to see a whole new interaction, because right now I think we need it. We're on an evening where there are people tonight protesting in Minneapolis, and I haven't got to check on what's actually happening here. So people want change. People want to be different. We're tired of the abuses on humanity and to each other, and we want to see a different way. And so I think with all of us working together, if we just fight back a little bit, government will back down. And it's just been our inability to be afraid to step out on the line for each other that has held us back for so long, that we have a chance now to show each other, show the world, we're all standing up for each other. Hong Kong protests have resumed. People are really tired of being controlled. And I think if we take that one extra step, just one extra step, we can actually gain back some power that we have lost for, at this point, hundreds of years. The politicians used to be afraid to make mistakes because they could be tarred or feathered or strung up or hung or executed on sight. Now, nothing will really happen to them, so there's no real actions for consequences. And I totally appreciate, you showing people a new way of medicine, and just from a different perspective that they may have never heard before in life. Maybe they've only been to allopathic doctors, and now they have a new outlook on how they can control their life. Maybe for the first time, they may have hope about a certain, ailment or condition, that they now can try to reach out to homeopathy doctors or naturopathic medicine doctors in their area, try to find a clinic, and try to hook up with that professional to then create a whole new chapter in their life. That's what I'm hoping that people will try to achieve out of this, is understand through different and alternative modalities, you can regain health and regain control of your life. And that's what we need at this point. We need a revolution of people in charge of their own bodies, their own minds, and shifting the energy into something positive and beautiful that we can just keep compounding on. If groups get bigger, the darkness will kind of fade off into the distance.
I love that. Yeah, that's so inspiring. And thank you so much for having me, Scarlett. I will send you all those links for your viewers. And Bonnie, thank you so much. Good to meet you, Bonnie.
Yeah, we had a few other people like Lee in the chat room and a few other people. A lot of people lurk. So, they had said some things earlier when we were kind of in between. And, people said they wouldn't take the vaccine. And, people have not been, people are concerned because they're older. Lee said she's helping her kids with natural medicines. So a lot of people, I think, are kind of changing and thinking about different ways of just helping each other, helping their families. So I'm so excited for everybody. And if you have any other questions, I will give you the way to get a hold of Dr. Jackson. You can find her at Dr. Anna ND on Facebook and contact her that way. I don't know if people are out in Washington, which Bonnie is. So I know she might be calling you. She might be getting in contact because she's out there. And if people are out in Washington, Oregon, or California to think about being in contact with Dr. Jackson, you can go to healthyrootsclinic.com if you are out in those areas to just find out more information and kind of what she's about. And like she said, she's going to be adding more content on the teaching tab. So if you want to learn and kind of follow along on this journey of where she's going with new things and just keep up to date, just with someone who posts really good information is how I started following you. So, you can get a wealth of information and knowledge and have people who are on your side ready to fight for you. I think that's really important is, so many government structures or medical structures aren't fighting for you. But to have people out there who really believe that it's about you to take control. Don't trust me what I say. Challenge it. Look into it. Make sure that you know and you feel confident in this. I think that is the key to people breaking through this old paradigm of control and saying, look, I don't have to go to the doctor anymore. I haven't been to an allopathic doctor in the last 3 years because I've used natural medicine and changed the way I interacted with my body, the way I interact with food, using food as medicine, getting cleaner sources of food. And people can do this with small incremental changes. It doesn't have to happen overnight. It doesn't have to be a complete life shift and one day everything's different. It can be small incremental changes in diet, lifestyle habits, exercise, well-being, mental health, to where eventually you wake up one day and say, everything about what I'm doing is different. And now I have confidence to move forward. So I hope that's what we could bring to you guys here on the Freedom Revolution Network. Thank you for joining my first episode of Freedom Revolution Network News. On other nights, we will be doing more of a hard news with just broadcasts of the news, articles and topics that we'll just be talking about what's going on. And that'll be done bi-weekly on Tuesdays and Thursdays at 8 p.m. Central Standard Time. So thank you for joining us here on the Freedom Revolution Network. I appreciate you for being here. And it's been really enlightening and it's been I've enjoyed my time here. I definitely have. It's been very fun.
Thank you so much, Scarlett. I so appreciate this.
Yeah, and I'm sure everybody after listening to this and when we get out to all of our other podcast platforms and we kind of get the feedback, and you guys can email me at stationmanager@freedomrevolutionnetwork.com to give us some feedback about what you liked, what you want to hear more about. If you have messages to pass on to Dr. Jackson, I will definitely do that for you. So just tell us what you think. What did this bring to you, and what changes may you wanted to bring after this? And I hope to hear what everybody has to say, especially because this is the time to take control. This is the time, the year of 2020, they're saying, last year was the, health threats. This year is the year to take control. Well, if they get to take control, so do we. And it's time for us to be empowered as individuals, as we the people, and stop being afraid. If we don't stand out on the line, everybody's going to get snatched up and we'll be alone. We won't have anyone to speak out for us. So let's all put ourselves on the line together and stop the fear. The fear is what's holding us back. The fear is what paralyzes us. The fear causes disease. It causes the cells to lose structure and basically pollute itself. So let's stop polluting ourselves, start promoting health and wealth and just well-being. And I think we can do that with one another. So I appreciate you. Thank you so much. And everyone out there, join us again for Freedom Revolution Network News, and we will see you on the flip side.
Bye.